Hi everyone, today we're covering different types of headaches. Headaches are broadly classified into primary and secondary headaches. Primary headaches, they have no underlying disease or there's no underlying cause. It just occurs once in a blue moon. It could be acute, it could also be chronic, but it just occurs out of nowhere. But there's no underlying cause. Some people have very frequent headaches. It doesn't mean that they have a tumor or they have some hemorrhage or something like that. No, it just happens out of nowhere. And secondary is due to a cause. So secondary has some underlying disease that is there. Maybe the eyesight is weak, maybe they have a tumor, maybe they have some other infection like meningitis, could be anything, right? Now, primary headaches majorly have tension type headache, migraine, and cluster headache. Very important. These three you need to know. Primary headache, migraine, and tension type. Sorry, tension type, migraine, and cluster. So tension type, migraine, and cluster. Now, tension type is due to a lot of stress. A person takes a lot of stress, they have tension type headache, and this is bilateral and it has a band-like pattern. So here you can see this is the tension headache, then migraine, and then cluster. So band-like pattern, and it is bilateral. This happens because of a lot of stress and there's no nausea or vomiting with it. Migraine is usually unilateral and it's throbbing. By unilateral, I mean that it occurs in the half of the head. So like this, right in front. So half side. So unilateral and there's throbbing pain, right? So this is migraine, and it is associated with nausea, vomiting, and sensitivity to light. So if anyone has migraine, just ask them. If you want to tell anyone or diagnose anyone by saying that, oh, maybe you have migraine. For example, the other day my sister called me and she's saying, I'm having a lot of headache. My parents, they were getting so concerned. They thought maybe, God forbid, if there's something, so they wanted us to undergo CT scans and stuff. But no, you do not need to directly, for example, I told her that maybe it's a migraine, but what are the signs and symptoms of a migraine? I should ask her that if she's having it unilateral or bilateral, if it's on both sides or one side, she'll say unilateral. Ask her if it's pulsating and throbbing, like she'll tell me that as well. And then she was telling me that she's feeling nausea and vomiting. And other than that, she was also very sensitive to light, photophobia. Like she wasn't able to open eyes and look at the light and even sounds. She was really like prone to that. So may have aura before headache. So this is migraine, right? Then cluster headache. This is severe and unilateral, and this is usually around one eye. For example, this unilateral, so it's around one eye. Cluster headache, and it occurs in clusters, repeated attacks associated with tearing. For example, there'll be tears rolling down the cheek, and there'll be nasal congestion. So these are three important, right? So I hope that's clear with you. What all do we have? We have, where's the image? Wait a second. Let me open that. Yeah, here. So basically, uh, okay, before I move to this diagram, let's look at the secondary headaches. These are due to underlying causes. What could be the underlying disorders or causes? Space occupying lesions like intracranial tumors could be a cause. Infection or meningitis, encephalitis, it could be a cause. Subarachnoid hemorrhage. Remember, subarachnoid hemorrhage happens when there is cerebral aneurysm when that ruptures. So a person can have subarachnoid hemorrhage. Then cerebral venous sinus thrombosis. Cerebral venous sinus thrombosis. It could be due to giant cell arteries or intracranial hypertension, right? So this is something important. So vascular cause could be subarachnoid hemorrhage, infection, raised intracranial pressure could be one cause, or a trauma-related head injury could be a cause, sinusitis, hypertension, eye problems, glaucoma, or because presbyopia, or maybe the person is his eyesight is weakening, so that could also be a potential cause. So primary could be tension, migraine, or cluster, and secondary has something serious causing it, right? So these are the types of headaches. Now let's look at this diagram right here, this table right here. So you can see tension type, band-like, bilateral. Migraine is unilateral and half of the face. Cluster around the eye, unilateral, right? And then you can see about the treatment also, beta blockers you're using for the migraine. And for tension type, you're using NSAIDs. For migraine also, you can use NSAIDs. For unilateral, you're using you can see sumatriptan, right? And band like, then the other has phonophobia and photophobia, and cluster is excruciating periorbital pain. So yeah, that's it.